Hello, friends. Today we are going to discuss stress. Men are disturbed not by things, but by the views they take of them. Epictetus. No stress can kill you. Manage it with willpower. The greatest weapon against stress is our ability to choose one thought over another, says William James. I am Dr. Jagaji Singh Virk, MBBS, FCGP, FAMS, PG, DGM. What is stress? Stress is a normal human reaction that happens to everyone. In fact, the human body is designed to experience stress and react to it. When you experience changes or challenges, those are the stressors. Your body produces physical and mental responses. That is stress. Stress is the psychological, physiological, and behavioral response by an individual when they perceive a lack of equilibrium between the demands placed upon them and their ability to meet those demands, which over a period of time leads to ill health, says Palmer. What does it do? Stress responses help your body adjust to new situations. Stress can be positive, keeping us alert, motivated, and ready to avoid danger. For example, if you have an important test coming up, a stress response might help your body work harder and stay awake longer. But stress becomes a problem when stressors continue without relief of periods of relaxation. And that is called chronic stress. What happens to the body during stress? The body's autonomic nervous system controls your heart rate, breathing, vision changes, and more. Its built-in stress response, the fight or flight response, helps the body face stressful situations. When a person has long-term, that is chronic stress, continued activation of the stress response causes wear and tear on the body. Physical, emotional, and behavioral symptoms develop. How stress presents in the body? Aches and pains, chest pain, or a feeling like your heart is racing, exhaustion or trouble sleeping, headaches, dizziness or shaking, high blood pressure, muscle tension or jaw clenching, stomach or digestive problems, trouble having sex, weak immune system. Presents in emotions as well. Anxiety or irritability, cause depression, maybe panic attacks or sadness. How people try to escape from the stressful situations. Drinking alcohol too much or too often, gambling, overeating or developing an eating disorder, participating compulsively in sex, shopping or internet browsing, smoking or using drugs. How is stress diagnosed? Stress is subjective, not measurable by tests. Only the person experiencing it can determine whether it's present and how severe it feels. A healthcare provider may use questionnaire to understand your stress and how it affects your life. If you have chronic stress, your healthcare provider can evaluate symptoms that result from stress. For example, high blood pressure can be diagnosed and treated. Stress versus burnout. While stress is our response, Burnout is the accumulation of excessive stressors over time, which results in unmanageable stress levels. American psychologist Herbert Friedenberger first termed the word burnout in the 1970s, referring to the effect of extreme stress and high ideals placed on helping professionals such as doctors and nurses in depression. What is burnout? 2018. What stress can cause? Stress has been referred to as the silent killer. Telogen effluvium is the result of hair loss caused by stress that can happen up to 3 months after a stressful event. Stress accounts for 30% of all infertility problems in women. Stress can cause spasm in the fallopian tubes and uterus. In men, it can reduce sperm count and cause erectile dysfunction. Researchers have found that stress worsens acne more so than the prevalence of oily skin. Stress can cause weight gain too. Correlations have been found between stress and the top 6 causes of death: cancer, lung ailments, heart disease, liver cirrhosis, accidents, and suicide. In children, chronic stress has been found to negatively impact their development growth due to a reduction of the growth hormone in the pituitary gland. Stress can increase the likelihood of developing blood clots since the blood prepares itself for injuries and becomes stickier. Chronic stress can place pressure on and cause damage to arteries and organs. Stress is also responsible for altering our blood sugar levels, which can lead to fatigue, hyperglycemia, mood swings, and metabolic syndrome. Identify the sources of stress in your life. Stress management starts with identifying the sources of stress in your life. This isn't as straightforward as it sounds. While it's easy to identify major stressors such as changing jobs, moving, or going through a divorce, pinpointing the sources of chronic stress can be more complicated. It's all too easy to overlook how your own thoughts, feelings, and behaviors contribute to your everyday stress levels. To identify your true sources of stress, look closely at your habits, attitude, and excuses. What helps to keep you stress-free? Keep a positive attitude. Accept that there are events that you cannot control. Be assertive instead of aggressive. Assert your feelings, opinions, or beliefs instead of becoming angry, defensive, or passive. Learn to manage your time more effectively. Set limits appropriately and say no to requests that would create excessive stress in your life. Make time for hobbies and interests. Don't rely on alcohol, drugs, or compulsive behaviors to reduce stress. Drugs and alcohol can stress your body even more. Seek out social support. Spend enough time with those you love. Seek treatment with psychologists or other mental health professional trained in stress management or biofeedback techniques to learn more healthy ways of dealing with the stress in your life. Some strategies for stress relief. You can't avoid stress, but you can stop it from becoming overwhelming by practicing some daily strategies. Exercise when you feel symptoms of stress coming on. Even a short walk can boost your mood. At the end of each day, take a moment to think about what you have accomplished, not what you didn't get done. Set goals for your day, week, and month. Narrowing your view will help you feel more in control of the moment and long-term tasks. Some ways to prevent stress. Many daily strategies can help you keep stress at bay. Try relaxation activities such as meditation, yoga, tai chi, breathing exercises, and muscle relaxation. Take good care of your body each day. Eating right, exercising, and getting enough sleep help your body handle stress much better. Stay positive and practice gratitude, acknowledging the good parts of your day of life or life. Accept that you can't control everything. Find ways to let go of worry about situations you cannot change. Learn to say no to additional responsibilities when you are too busy or stressed. Stay connected with people who keep you calm, make you happy, provide emotional support, and help you with practical things. Meditation. It has been around for over 5,000 years for a reason. Meditation works well for many people and has many benefits. It can lower stress, anxiety, and chronic pain, as well as improve sleep, energy levels, and mood. To meditate, you will need to find a quiet place, get comfortable sitting or lying down, focus your attention on a word, phrase, object, or even your breath. Let your thoughts come and go and do not judge them. Behavior. How you respond to people directly impacts your stress levels. Manage your response with these tips. Try not to overcommit yourself. Share the responsibility. Count to 10 before you respond. Walk away from a heated situation. Distract yourself with music or podcasts. Sorry. Inner voice. Nothing affects your stress levels like the voice inside your head. The good news is you are in control. You can exchange negative thoughts for positive ones. There are more benefits to positive self-talk than reducing stress. These include a longer life, lower levels of depression, greater resistance to the common cold and cardiovascular disease, and better coping skills for when hard times hit. Laugh therapy. When you laugh, you take in more oxygen. Your heart, lungs, and muscles get a boost, and your body releases those feel-good hormones. Laughter also improves your immune system, lessens pain, and improves your mood for long periods of time. Talk therapy. Long-term talk therapy helps some people deal with stress. One approach, cognitive behavioral therapy, helps you change negative thought patterns. Your therapist can guide you toward other approaches that might be helpful. Tips for building relationships. Reach out to a colleague at work. Help someone else by volunteering. Have lunch or coffee with a friend. Ask a loved one to check in with you regularly. Accompany someone to the movies or a concert. Call or email an old friend. Go for a walk with a workout buddy. Schedule a weekly dinner date. Meet new people by taking a class or joining a club. Confide in a clergy member, teacher, or sports coach. Make time for fun and relaxation. Set aside leisure time, recharge batteries. Do something you enjoy every day. Stargazing, piano, reading. Keep your sense of humor. Laugh at yourself. Take up a relaxation practice. It could be yoga, meditation, or deep breathing. Manage time better. Don't overcommit yourself. Scheduling back to back. Prioritize tasks, list, tackle them, and unpleasant first. Break projects into small steps. Large, overwhelming projects should be divided into and focus manageable steps first. Delegate responsibility to others where you can't do. Maintain healthy lifestyle, eat healthy diet, reduce sugar, caffeine, avoid alcohol, cigarettes and drugs, get enough sleep. Deep breathing. Most people take short, shallow breaths into their chest. It can make you feel anxious and zap your energy. With this technique, you will learn how to take bigger breaths all the way into your belly. Get comfortable. You can lie on your back in bed or on the floor with a pillow under your head and knees, or you can sit in a chair with your shoulders, head, and neck supported against the back of the chair. Breathe in through your nose. Let your belly fill with air. Breathe out through your nose. Place one hand on your belly. Place the other hand on your chest. As you breathe in, feel your belly rise. As you breathe out, feel your belly lower. The hand on your belly should move more than the one that's on your chest. Take 3 more full deep breaths. Breathe fully into your belly as it rises and falls with your breath. The tapping solution. It's a scientifically proven technique that works to rewire the brain by sending calming signals to the amygdala, the stress center of the brain, allowing both the body and brain to release limitations from negative experiences, emotions, thoughts, and much more that hold us back from creating the life we want. Most people don't realize how big of an impact chronic stress has on their life. It affects their health, their ability to think clearly, and their ability to be happy and to create the life they want. It doesn't have to be this way, though. Thank you very much.